For the first time, the CDC says 100,000 Americans have died from drug overdoses over the course of just 1 year.
This comes as the DEA says drugs laced with fentanyl are becoming a big problem in eastern Oklahoma. News on 6's Chin Doan is live after talking to the DEA and EMSA. Chin.
Lori and Brian, one pill can kill. That's the message law enforcement and health experts want everyone to remember as traffickers try to sell millions of fake pills. The DEA says 2 milligrams of fentanyl, as small as a pencil lead, could kill.
For example, a young adult that decides to take a pill from a friend that's a Xanax, while not knowing that that Xanax could possibly contain a lethal amount of fentanyl. First-time user, take one pill, and it absolutely can kill you.
David King, resident agent in charge for the Tulsa area, says fentanyl is on the rise because it's cheap plus easy to make and transport. King says his office has seized more fentanyl just in the last 6 months than in the past 3 years combined. King tells us agents are working with state and local partners to go after traffickers.
Heroin is predominantly on the uptick, even though meth is still our predominant killer in the state of Oklahoma. Overdose deaths concerning synthetic opioids and opioids is on the increase.
1,009 Oklahomans died from an overdose last year, the most ever on record in our state.
We deal with the gambit of overdose types, from narcotics to stimulants like cocaine and methamphetamine.
Christopher Jenkins with EMSA says in eastern Oklahoma, his agency administers Narcan 70 to 80 times in an average month.
Definitely with the increase in potency of the narcotics, that definitely poses some challenges to us in the timeliness of them calling for help.
The DEA says education saves lives. You should only take a pill if it came from a pharmacy and was prescribed to you. Live in Tulsa, Chin Doan, Oklahoma's Own, News on 6.